that we're actually the only clinic in Coachella Valley that provides 100% of the time no charge health care. We never charge a patient for the services that they receive, and we never bill any insurance company or Medi-Cal or Medicare for the services that we provide. There are other clinics around town, but none that do it the way that we do, utilizing volunteer providers. So on average now we see about 1,000 patients, providing about 3,500 individual one-to-one contacts with them. So an actual visit between a patient and a physician, or a patient and a dentist. Over and above that, then we probably have another 1,500 contacts a year for patients around diabetes education, wellness programs, health navigator services, social service, community referrals, another whole group of other services that are provided that help that individual manage their care, be healthy, but also to survive in the community, to be able to afford to buy healthy foods from the grocery store, because we were able to refer them to low-cost housing, for example, or to get them legal assistance because of some legal issue that was going on that they just weren't aware that those services were out there. Other thing would be the fact that we're using volunteers. Over 230 volunteers annually come into the clinic. That's volunteer physicians, volunteer nurses, nurse practitioners, dentists, nurses, medical assistants, everyone from the front of the office all the way back to the patient exam rooms. Those are all volunteers, and they contribute somewhere in the neighborhood of about $400,000 a year in donated value to our annual budget. The last thing that I think is important to note that people don't understand about the clinic is probably right around half of the patients that we see are actively employed either full-time or part-time, or they're seasonal workers. So they're individuals who are out there contributing to the community, and they do not have they don't have health care. They're the people that work in the restaurants that we visit, that work in the hotels that when family members come in that they stay at. They're people that don't receive health care benefits from their employers. They're also people who may be self-employed, people that work for us as housekeepers and domestic help, caregivers for an elderly relative. They're individuals who clean our pools and mow our lawns and do all those sorts of things that are able to survive and keep, take care of their family. But the expenses, the expense, I should say, that goes with purchasing health care is just far too great for them. We also have a great number of people who maybe are not able to work for whatever reason, and while their spouse may work, they can't afford and have insurance through their employer, they can't afford to pay for insurance for that other person.